For those who may be considering medical school or just started and aren't fully aware, to practice medicine in the US, you have to write and pass the USMLE tests. USMLE stands for the United States Medical Licensing Exams. You have to pass these tests in order to be licensed to practice in the US. So I decided to make this video because I've been getting many messages on how to study for these STEP exams, asking what scores I got, what scores you need to match, and matching it to specialties, and so on and so forth. Every time I answered one of these, another one would pop up. So instead of trying to answer all the messages, I decided to make this video. In this video, I'm going to be going over what scores I got, what those scores mean, and show you the study plan that I used to make getting the scores I got pretty easy. Before we start, I'm going to ask that you please like the video and subscribe to the channel. This really helps me to see if making these videos are worth my time, and also helps me to see if the information I'm giving out is helping. Also, if you want to hear more about something, then feel free to ask or just leave a comment in the comment section below. I don't know what people are having difficulty with or are confused about unless somebody tells me. So these comments help guide my talks, and I really appreciate it. So before we talk about the main points of this video, I'll just talk a little bit about the STEP exams. So there are 3 USMLE STEP exams, technically 4, but they're called Step 1, 2, and 3. Step 1 is an 8-hour multiple choice exam. It consists of 7 40-question blocks with up to a maximum question number of 280 questions. Out of this 8-hour period, you have 45 minutes for taking breaks whenever you feel like it, and you have an optional 15-minute tutorial. So this breaks down, and this is similar throughout the STEP exams. You have a minute and a half or 90 seconds per question. These exams change a little bit over the years. They might add questions, take away questions, interspersed throughout the exam. They have a few experimental questions as well, which you can usually tell what they are just because they're a little more on the extreme edge, and basically they put in these questions just as experiments to see how students do and to see if they would work as actual questions on the exam. For non-US or Canadians, so people who go to medical school outside the US or Canada, the exam costs about $1,000. So the Step 2 exam, it's broken down into 2 separate exams. One is the clinical knowledge exam and the other is the clinical skills exam. So the clinical knowledge exam is 1 day. It is 8 60-minute blocks with a 45-minute break and a 15-minute tutorial. In total, it is 9 hours long. Each block is 40 questions. Again, about 1.5 minutes per question. The total amount of questions is up to a maximum of 318, and this portion of the Step 2 exam also costs about $1,000. The clinical skills exam, it is 8 hours. It consists of 12 patient encounters where you do a history and physical, you record the information, you provide a differential diagnosis, and your workup and treatment plan on a computer. You get breaks after every 3rd patient, and this exam costs about $1,600. The USMLE Step 3 exam, this is the longest exam. It is a 2-day exam. On the first day, you have 8 hours, again with some break time factored in, and you get 232 multiple choice questions. On day 2, you come back, and this is a 9-hour day. The first half of the day is 180 multiple choice questions. The second half of the day is 13 computer case simulations on the computer, where again you go through history and physicals, you order and review tests, you order treatments, and you diagnose the patient. The cost of this exam is about $900. So for those who are unfamiliar with the STEP exams, they are pretty notorious for having very long vignettes. A vignette is this kind of question stem that you see up here. Some will literally talk about things that are irrelevant to the question, except for the last sentence, just to waste your time. Some questions are regarding short excerpts from made-up articles or made-up drug brochures that they present to you. These also take some time to read, and also sometimes the questions are unclear and it takes time to understand what they want from you in that question. Another annoying aspect is that in the exams, you're supposed to choose the most correct answer. Now, there may be multiple answers that are correct, but you have to choose the one that is the most correct. So this is the timeline for when you would write your medical or your licensing exams. Usually your Step 1 exam is written between or after your second year, or between your second and third year, specifically before your rotations. If you're an international medical graduate, then you need to write your Step 1 exam before you are able to do rotations. At least in my experience as a Caribbean student, that was what needed to happen. US students, from my knowledge, can begin rotations without writing the Step 1 exam. The Step 2 exam is typically written between your third and fourth year, and the Step 3 exam is written once you are in residency. So this is viewed more as a pass-fail exam because it has no bearing on being accepted into a residency program, because you write it during residency. So this is important to know. The USMLE plans to change their Step 1 from a graded exam to a pass-fail exam, and they state that they're going to be doing this no earlier than January 1st, 2022. Some of the reasons that they give is that the exam is overemphasized. It can cause undue distress on the student, and that the point of the exam is for licensing and not really to differentiate residency applicants based on knowledge. So you might be asking yourself, if this is the case, then why should I put so much work into doing the best I can on the exam if my goal should just be to pass, right? That's wrong. You really want to do the best you can on this exam. Some of the reasons that, number one, is that passing the exam is not a given. It's, there is a high pass rate, but it is still a difficult exam, and when you set your expectations low, you tend to perform worse. Some of you might be familiar with this curve, but it basically states that when the level of pressure is low or very high, your performance tends to take a hit. But if you have a moderate to high amount of pressure, that's when you tend to have peak performance. So you don't want to convince yourself that the goal is just to pass and put a low amount of pressure on yourself, because then you risk there's a risk of you underperforming and potentially failing the exam. This is information that's I think is available on the USMLE site. Basically, it's showing the pass and fail rates of first-time takers and those that repeated the exam. So this is for exam takers from US or Canadian schools, and you can see that the first-time exam takers pass at about a 96%. So 4 out of 100 fail the exam. That's pretty good. It's a little bit different when you look at international medical graduates. Our passing rate is 80%, so 1 in 5 fail the exam. Failing this exam really sucks, because now you have to review at what point you went wrong in your studies. You likely have to repeat months worth of studying. You have to pay another nearly $1,000 to schedule the exam. It's 8 hours worth of exam. You have to schedule the time and transportation to get to the testing center. A big reason for this low, it's not too low, but it's lower than US or Canadian medical school students, is that a lot of international medical graduates, English is not their first language. And so it can take them a good bit longer to read through the question, understand the question, and that just eats up time. Most people who speak English fluently, they either run out of time on the STEP exams, or they finish the exam with only a few minutes to spare. So time is a serious factor on performance in the exam, and people who take longer because their English may not be that great really tend to have a difficult time. So second reason why you want to do the best you can on the Step 1 exam, there's less opportunity for competition. You know, when you take away the Step 1 score, it makes people, it gives less factors that programs can consider when ranking applicants. So everyone looks the same when applying for residency, so who stands out? In this case, because you're removing one factor, the remaining factors now become more important. And what are those remaining factors? Those are your medical school grades and your clinical rotation exams. So if those aren't good, then a good STEP score can really save your application. But now that they're taking that away, it's just one more thing that you have less to prove that you are more competitive than other applicants. Oops, wrong way, sorry. A third reason that you really want to do the best you can on this exam is that you're building the knowledge base that you will use for the rest of your career, and that knowledge base should be rock solid. You're going to be using the material you know now to treat patients and hopefully improve their outcomes, and you really need to have a solid knowledge base in order to do that effectively. The fourth reason, and I think this is probably the most important reason, is that you're going to be tested on a similar material on Step 2 and Step 3. So again, like I said earlier, Step 3 is considered more of a pass-fail because you write that after you get into residency. But now Step 2 is probably going to become the Step 1 in terms of a marker of performance. So it's better to know the material well now, because you're just going to have to relearn it all again when you prepare for Step 2. And again, you're going to be taking Step 2 between your third and fourth year during clinical rotations. And a lot of these rotations that you're on, you really don't have any free time to do additional studying, or you might only be able to do minimal studying. So it's really important to do your best to learn the material at the time it's presented and forwards after that. So those were reasons why you should do well on the STEP exam. I'll go over the scores I got in a few moments, but before that, I want to give you guys a look at what programs are looking for, what factors they cite, and how heavily they weight those factors. And all this information is freely available on the NRMP website. I have the link here. You can take a look for yourself, but I'll just go over these pretty quickly. And you can see here that the number one factor, or the most common factor that programs use and pretty highly rated, is your Step 1 exam. You can look through all of these. You know, they have letters of recommendation, your dean's letter, your Step 2 exam, grades and clerkships, your class ranking. Pretty much the most highly, or the most commonly used factors, and some of the most highly weighted factors are all about how well you did, what kind of grades you got throughout your medical school career. It's not just one exam or this exam or certain courses. It's an accumulation of your entire medical career performance. All of it is important. So getting into the mentality that you just need to pass, it's the wrong mentality if you want to try to get into a competitive specialty. So all of these are factors in selecting applicants to interview. There's also a different graphic or table for factors in ranking applicants. So it's one thing to get an interview, it's a different thing for the program to like you and rank you for a potential match. So in interviewing people, they don't know who you are, all they have is your resume. So the thing that really helps them decide is what numbers they're seeing in terms of your grades. Once you get to the interview, the most important factors are your interactions. You can see the first three, actually the first four: interactions with faculty, interpersonal skills, interaction with house staff. This means anyone that you meet on the hospital grounds, and feedback from current residents. Now, as long as you're a normal, respectful person, almost everyone gets a pass on this. It's hard to mess up, but messing it up can be done. Since most people, at least during the interview process, come off as nice and normal, this means that the main factor affecting your ranking is, you guessed it, it's grades. Grades and letters of your performance. So for example, letters of recommendation, dean's letters, things like that. Another top reason shown here, and I can say from my exposure to how applicants are selected, is why are they interested in the specific location. You can see that over here, perceived commitment to the specialty and perceived interest in the program. So if you're born in the area, or if you have family around, or some kind of strong connection to the area, or reason for being there specifically, this is looked on pretty favorably. So I'll get to my exam scores, and this is my Step 1 exam report. You can see the date that I took it. You know, your USMLE ID number is here, and your name goes here. I blocked those out. But here you can see the score that I got. And this is the Step 2 clinical knowledge exam, the date I wrote it, and the score that I got. And then similarly, my Step 3 report, wrote it on this date, and this was my score. So before we go over what the scores mean, I'll just go over the minimum passing scores, and you can see them here. And again, this information is freely available on the USMLE website. Here's the link. And then here are the mean scores, and this is from US and Canadian medical school students, first time takers, and these are the years. And again, this information is freely available on the USMLE website. Another, or some more freely available data, again from the USMLE website, they show you what your score means. So instead of just a pass-fail, you get a numerical value, and they show you where on a bell curve, or what percentile on a bell curve that correlates with. So I have, you know, this is the top half of the table, and this is the bottom half of the table. I had to break it up because otherwise it would be too small for you to see well, but I've pointed out here where what percentile I sit in. And this is usually a typical trend to have decreasing scores, and that's because, again, there's a heavy emphasis on the Step 1. People really study hard for that. Then the Step 2 is kind of, you want to get a good score, but it's not the end of the world if you don't do great. And then Step 3, again, is more of a pass-fail. This is written during your residency. Again, it doesn't have any effect on your ranking trying to get into residency because it's only written afterwards. So my study philosophy and my Step 1 preparation, as I've shown you before, and what I want to stress again, is that the goal should be to do well throughout medical school. You don't want to do well in a few courses or a few exams. You want to do well in everything, and you want to get good letters of recommendation and a good dean's letter and good reviews through your clinical rotations, and you just want to have a good performance throughout your medical school career. This is really important if you want to get into a more competitive specialty. But if you want to go into something more general, this doesn't really apply, since you can usually get into general fields like internal medicine or family medicine or obstetrics and gynecology or psychiatry. Those are easier to get into, and really, as long as you get passing grades, you have a good chance of getting into those residencies. But again, it's still good to have a good knowledge base. So I'll tell you exactly how I got my scores, and I just felt the best way to do this was put this in kind of bullet point format, and I'll just read them through one at a time. There's not really any other way to do this, but pay attention in class. A lot of the times I'd see my colleague students, they'd be working on other things during a lecture, or doing other things, or just not being there mentally, and this was a mistake. Because the 2 hours in class that they missed, they would spend 3 to 4 hours reviewing it on their own because it wasn't explained to them. So, do your best to pay attention in class. I know it can be hard, but that's what you should be doing. You should use the lectures provided to you as primary source of learning, because the questions that you get on your course exams at your specific school, they tend to come from your core course lecture material. So that's really the best source if you're planning to do well in your respective courses. As you go through your courses, you should be reading associated sections in first aid. You're going to be reading this again and again and again, and just that repetition helps you remember it a little bit better when you really need it. Some one resource I used was the board review series, and they have your anatomy, histology, physiology, neuroanatomy. They have all those different sections, and I would only really use this for their question sections. There are lots of digital copies. They're floating around everywhere. You shouldn't have any problem finding it. If you do, then just ask one of your upper year classmates. I did the Kaplan question bank during my courses. I took notes on the questions that I got right and the questions that I got wrong. I flagged interesting questions and revisited them later, closer towards the STEP exam. I watched through the Kaplan videos and the doctors in training videos. I went through Pathoma and the Kaplan course textbooks. I did the UWorld question bank after finishing all of this stuff here, and I started the UWorld question bank maybe around my 4th or 5th semester. And again, I would take notes on all the right answers, all the answers I got wrong, and I flagged all the questions I thought were interesting or maybe had a good learning point. I did a few practice NBME exams. These are like mock STEP exams that you can do at home. I spent lots of hours studying after class. I reviewed material from prior semesters during my break in between semesters. I didn't use Anki. I know that's a very popular, like a flashcard memorization tool. I just never got into it. I have nothing to say against it, but I just never got into it. And something I want to make clear is that a lot of people start their USMLE prep, a few weeks or a few months before the exam. I think the mentality you should have, and the mentality that I had, was that my preparation for the exam started the same day I started medical school. I didn't wait to start preparing for it later. The last thing I want to say is a lot of people are offering, these kind of study schedules. A lot of people like to make these study schedules. My personal opinion, I never use this, and I think it's a waste of time. People can get into the habit of spending a lot of time just building a schedule, but things change. They need to make adjustments. They feel that if they've completed what is on the schedule, they're done, and that's wrong. They may feel that if they weren't able to complete the scheduled work, that they failed. I think that's also wrong. Instead of using all this time to make a schedule, just study. If you are minimizing the time on other tasks and you're maximizing the time on studying, then that's the best you can do. You are studying for the maximum amount of time, and whatever way you go about it, you can't do better than that. So that's all I have to say in this video. Again, if you liked it, then give it a thumbs up. If you want to see more of this stuff, then subscribe to the channel. And if you have anything that you want to see in future videos, or any questions you want me to go over, or if something wasn't clear, then just please leave a comment in the comment section below, and I'll try to get back to it. Thank you very much, and take care.